Easy as pie, lemon, apple or cherry. Loving you is so very sweet.
Good Tuesday afternoon, folks. My name's Daryl Russell. I'm a licensed insurance agent here in Overland Park, Kansas, and welcome to AMS Live. We're live streaming today. We've got a pretty good show we put together for you. Doing this completely live, no teleprompter, no nothing. But I just want to talk a little bit about what we're going to do, how we're going to do it. First of all, this is a live stream. You can ask your questions during the live stream by using the chat. We're going to go over some of the more frequently asked questions live, like how do I sign up for Medicare? Part A is free. Do I need Part B? How do I find the best supplement plan? What's the difference between Medicare Supplement, Medicare Advantage? My favorite, why Medicare is so complicated. And for those of you that are turning 65, have turned 65 recently or about to, I can't tell you how many times I get people asking me, why do I get all these phone calls? Why do I get so much mail? How do I make it stop? We'll talk about that last. So yeah, I'm teasing you a little bit. You got to hang around for a little while to catch everything here. So anyway, hope you enjoy the program. If you do, we've got a new thing going. It's called Buy Me a Coffee. We're basically a virtual tip jar. If you do business with us, we'll make a little commission. If you don't and you like what we do, you can always buy us a coffee. It's $5. So anyway, just want to give you an idea of the screen, what we're running here today. We've got a couple different programs. Hopefully I'll give you a good show and you'll like everything that you see. So let's go and take a little bit closer look at how you ask your questions. You can text us online. We will go through that. The phone number here if you've got questions. Everything that I show you in the video, I'm going to leave links in the description boxes of the YouTube video as well as in our Facebook stream. So you'll be able to go back and the re-recorded version that'll be archived, access to any web pages that we mention, where to get documents, forms, that type of thing as well. So let's go ahead. Oh, this computer decided to go to sleep on me. Here we go. So I want to take a look at our more commonly asked questions. And again, what I forgot to mention, I'm going to stop doing live here. I don't like to fumble around. But anyway, I've been a licensed agent for almost 30 years, since 1993. Formerly before forming AMS, which is just short for Affordable Medicare Supplements. We're an independent insurance agency. I was actually a trainer with 2 Fortune 100 Medicare Supplement, Medicare Advantage companies, as well as a market director of one of the larger Medicare plans in the country. So I'm very well schooled. I've seen a lot on Medicare, and I love to teach and train. So I hope you enjoy some of the things that we've put together here. Now let's go to the live slides here. Okay, question number 1. How do I sign up for Medicare? Okay. Well, let's take a look at that. Here we go. Now, I'll include the link here, but this is a link to the Social Security website. Okay, it's just ssa.gov, and it's the section on Medicare and Medicare benefits. So it just talks about Medicare in general. This confuses people a little bit because Social Security office does the paperwork to sign up for Medicare, even though Medicare itself is a separate entity from Social Security. Why, you ask? Well, because in 1965, when Medicare first came into law, there wasn't any Medicare offices across the country, but there was Social Security offices, and so it was just a matter of convenience. The government didn't have to put brand new people in place. They could just have you go to Social Security office and fill out the forms, and that's just never changed, okay? So here on the website, it talks about Part A and B, how to sign up, when to sign up, and it states that most people age 65 or older are eligible for free Medicare Part A if you've paid enough in payroll taxes, and you can pay the Part B monthly premium. We'll talk a little bit more about that. You are eligible at age 65, and you can start signing up as many as 3 months before your 65th birth month, which includes the month you turn 65, and 3 months before or after. So how do I do that? Well, if you don't like computers, and I know some of you out there don't like computers, well, here's what you do. You pick up the phone, you call your closest Social Security office, and they may not be taking in-office appointments yet because of COVID, but they'll schedule a telephone interview, and they'll take your information from you over the phone. So if you hate computers, don't like them, don't have a smartphone, any of that stuff, just call Social Security local office. They'll do all the paperwork for you. They'll set up a phone interview. Give them at least a month lead time, because you're not going to call on Tuesday and get an appointment the next day. So just keep that in mind. If you like computers, or you're not afraid of computers, let me rephrase, then you can actually enroll yourself right on the Social Security website. And again, we'll include this link. So I'm still here on ssa.gov, and it says apply for Medicare only. And if I click this button, it's going to take me to another site here. My browser's being just a little bit slow. Hang on. There we go. So here I am on the Social Security website. It's just asking me a little bit of basic information. Do I agree to their terms? Well, if I want to use it, I have to agree. And then it's going to tell you about signing up for retirement and Medicare benefits. Now, one of the things that people get a little anxious about is they're like, Daryl, I don't want to draw my Social Security monthly benefits just yet. I just want Medicare. That's okay. Don't let this concern you because it says apply for retirement or Medicare benefits. It will let you just pick your Medicare A and B and leave your Social Security benefits alone. If you've shopped on Amazon, if you can go buy things on Google or do your trip online, you'll find this very simple, straightforward. It'll take you less than 10 minutes to apply online and go through that process. So it's a great tool. If you need help with it, if you've got a local agent that'll help you with it, get in touch with them. We do for folks all the time. So whether you're here in the Kansas City area, or you're like some of the folks that have called from California, Texas, different places like that, give us a call. Me, Justin, any of the other agents that work with us, we're more than happy to help walk you through that process. It's something that we enjoy doing. So, okay. Part A is free. Do I need Part B? Well, we live in a world of frugal folks, and occasionally I'll get asked this question. I don't have a lot of money for Medicare coverages. My Social Security is the only check I got. Do I really need to pay for Part A of Medicare? And the answer to that is generally yes. Okay. So again, I'm going to go to a website here, and I'm simply looking at, pardon me, this is the official Medicare website. Okay. So it talks about your Medicare coverage, inpatient hospital under Medicare Part A. Okay. So this means you've been admitted to the hospital as an inpatient after an official's doctor order which says you need inpatient care. Okay, so that's covered under Part A. And as we go down slowly here a little bit, you'll see that while Medicare Part A does cover the hospital, you do have a deductible. It's currently in 2021, $1,484 for each benefit period. No coinsurance for the first 60 days, and then so on and so forth. But this is where people get a little confused on Part A. What it covers is your room charge, your meals, general nursing, drugs as part of your inpatient treatment, and other hospital services. Now notice that doesn't say doctor, it says hospital. Now Medicare Part A also covers inpatient hospital for mental health care, and that's listed out there, but this is where I'm going back to. People ask, do I really need to pay for Part B? What does it say? It says if you also have Part B, then Part B generally covers 80% of the Medicare approved amount for doctor services while you get in the hospital. So in other words, if Medicare is all you have, you don't have group insurance through where you work, you don't have some other supplement, retiree coverages, all that type of thing, you are generally going to need Part B if you want to have full coverage under Medicare and to have your doctor's bills paid for while you're in the hospital. So that's very, very critical, very, very important question that we want to have in there. Okay. Coming up to the next question. How does Medicare work when I still have employer or COBRA insurance? And this is coming up a lot more and more nowadays. We're seeing a lot more folks delaying their Social Security till age 66, 67, 80, 68, so on and so forth, because they're still working. A, they enjoy working. B, they just need the income. They like the group benefits. Doesn't really matter. So because this is coming up, we need to take a look at what happens when you work past 65 and you have employer group insurance. First of all, if you or your spouse is still working and you have health coverage through that employer or union, it may be to your benefit to delay enrollment into Medicare Part A and B, okay? If you're drawing Social Security when you turn 65, you will be automatically enrolled into Medicare Parts A and B, okay? If you're going to continue to work, you obviously wouldn't want that Part A and B to take effect. Most people are not drawing their Social Security when they turn 65, so they have to auto-enroll. And everyone's really, really worried and concerned about paying late penalties under Medicare premiums and that type of thing. Well, if you're working, you're not drawing Social Security, it's up to you to sign up for your A and B. Now, Part A is free. There is no premium payment. Part B does carry a monthly premium of $148.50. So if you're working and you have good coverage, delay that Part B. There is no reason for you to sign up for Part B and pay that premium. Now, employer or union coverage is current employment, and it does not include COBRA, retiree coverage, VA, Veterans Administration, or individual health care, Obamacare. So what does that mean? It means a lot of people right now may be in a situation where they were working. Because of COVID, their employer eliminated positions, their employer went out of business, whatever, and they were eligible for, under the recent stimulus bill, the American Recovery Plan, if you lost your employment group insurance because of employer downsizing, layoffs, what have you, you could get 100% of your COBRA premium paid for through September under the American Recovery Plan. And if you turn 65 between now and September, even though your COBRA is being paid for by that subsidy through the stimulus package, you still need to sign up for Part B because coverage based on current employment does not include COBRA. You need to sign up for your Part A and B. Same with retiree coverage through a former employer. Veterans coverage, I have a lot of folks from time to time, they have VA and they don't want to pay the Part B premium. That's an option, but you're limited to only being able to use VA facilities when you get your care. Okay, so how does my other insurance work with Medicare? If you have retiree insurance from your spouse's former employer, then Medicare is the first payer. So you must enroll into Parts A and B because Medicare is going to pay first, and then what's left over will go to the retiree plan. If you're 65 or older and you have group health plan coverage based on you or your spouse's current employment, that's the key word, and the employer has 20 or more employees, then your group health plan pays first. You can delay parts A and B, meaning you don't have to pay the Part B premium. And once that employment coverage ends, you can sign up for Part A and B, no late penalties. There's a couple forms we fill out, a CMS 40B and a CMS L564. It's a two-part form. It's super easy. We'll get it all taken care of for you. If you are 65 or older, have group health plan coverage based on your spouse's current employment, but the employer has less than 20 employees, that's the key word here, then Medicare pays first and you must sign up and pay for both parts A and B. And then also you see another clip there about if you're under 65 and have a disability. Some folks do qualify for Medicare earlier than age 65 because they've been drawing Social Security disability benefits. Starting with your 25th month, you automatically get Medicare A and B if you're filed and qualified under Social Security disability benefits. So if you have group insurance available to you through a spouse's employment or another family member, and that employer has 100 or more employees, then your group health plan is the first payer, and you again can delay Medicare Parts A and B, meaning you don't have to pay that Part B premium, which is currently $148.50. Okay, let's go on to the next one. How do I find the best Medicare supplement? We get asked this question a bunch, folks, and I'm going to challenge you to stop back and let's think for just a moment. Medicare by itself is a confusing program, but it's very popular. If you get it all set up right, it works really well. And in America, it seems like our culture is such that we're like, I got to have the best. I got to have the best. And what I'm going to suggest to you is that when you're looking at Medicare supplements, the best Medicare supplement may be a little bit of a unicorn chase. Okay. And I realize I'm throwing something out there really kind of off the deep end, so to speak, but I want to take you to something here that you're looking at, and I want you to keep in mind that yes, there's some deductibles to Medicare, but if you keep it fairly simple and for the moment set aside the deductibles, Medicare pays 80% of what they approve. Your supplement only pays the remaining 20% left over of what Medicare approved. So when we're really stressing out about how do I get the very best Medicare supplement, we're talking how do I get the best coverage for the remaining 20%. Let me say that again. Medicare is paying 4/5 of the bill, and we're stressing out over 1/5 of the bill, okay? So let's take a look at some things I've got over on the other screen here. And again, I went to the official U.S. government website for Medicare. And again, I'll include all these links down below. We'll go back and put them in. But every Medicare supplement policy, and when you read government booklets, they call Medicare supplement, they'll use the term Medigap. So if it says Medigap, they mean Medicare supplement, vice versa. So all Medicare supplements must follow state and federal law, and they're all standardized. And anymore, you're pretty much looking at a Plan G, a Plan N, maybe a K or an L, but in anymore, it's a Plan G or a Plan N that people are looking at. With Medicare supplement companies and insurance, whether you get a Plan G from company A, B, or C, or you get a Plan N from company X, Y, or Z, the benefits you're getting in terms of the leftovers that Medicare A and B don't pay are the same. Medicare supplement agencies such as myself, AMS, and there's a lot of great insurance agencies out there, we will use software. Here I pay for a software tool called that we have available to us that basically lets me quote out all the different plans that are available. And we've got well in excess of 100 different companies selling Medicare supplement insurance. And we can sort by price, we can sort by how well is their AM Best rating, how well is their financial ratings with Standard & Poor's, search by company name. And we can also break down and go into market analytics. We can look and see how many members do they have in the nation, how many members do they have in the state, what's their loss ratios. There's all kinds of minutia that we can get lost in, folks. And I guess what I'm trying to say is, don't get so stressed out over Medicare supplements and trying to make sure you're getting the very best deal on this and that, because Medicare supplements are commodities. What I mean by that is a med supp is a gallon of gas. Now, certainly we want to go with a quality carrier. I'm not meaning to dismiss that. But every insurance company does, to a degree, have a personality, if you will. How easy are they to do business with for customer service? I think that in some cases is more important than a $5 or $10 per month premium in other areas. The other thing we look at is how many members do they have in their risk pool, so that if they have a big bad year in claims, do all those claims get spread out over a bunch of people, or are they a smaller company that maybe doesn't have as many members in the risk pool? And if they have a bad year, all of that can get split out and spread out between, not that many people. And that can certainly put pressure on them for premium increases. But really, when it comes to finding a quality Medicare supplement, in my opinion, the best Medicare supplement plan is the plan that you can afford the monthly premiums without it taking food off the table, so that it is in force when you need it and that you don't have to lose sleep at night over that. And if you can't afford a Medicare supplement premium, and some folks can't, there's nothing wrong with considering a Medicare Advantage plan or something like that. The other thing I'm going to throw out in terms of Medicare supplement, really what you might want to throw in there as a different question is, how do I find the insurance agency or agent that's going to provide me ongoing customer service and do reviews? Because supplement premiums can go up every year, and we do reviews for our customers. It's not been unheard of after 5-6 years to be able to find a different company that we can move a client to and save them $400, $500, $600 a year. Now, you do have to go through underwriting and health questions, and some agents and some YouTube videos make it sound like you can never do that. If you're dealing with a quality insurance agent or agency that knows what they're doing, they can tell you when you can get approved, when you might need to wait a month or two for something like that, what conditions. We've had some people come in that we wanted to put them with Company A, and Company A had a height and weight chart, and somebody was 5 pounds, 10 pounds too heavy for the first company's height and weight chart. There would have been an automatic rejection. You know what we did? We went to the next lowest premium, called them up. Do you have a height and weight chart? You know what they said? Nope. Fill out the application, send it to us. It was approved. So focus more on who's servicing your Medicare supplement business, and will they be around 5 years, 10 years down the road to help you out? And if not, call us up. We'll adopt you. We adopt orphans all the time, help get them the best Medicare supplement coverage that we can possibly find for them with quality carriers. Okay, get off my soapbox. How do I find the best Part D plan? Well, at risk of sounding like a little bit of a broken record, I'm going to go back to the same thing I was just talking about. Medicare Part D plans change every year. We see new plans come out all the time. Every calendar year, we'll see premium changes. Part D plans will also have drug lists. They call them formularies. If you want to do all the homework, you can go here to Medicare.gov and punch in show me find health plans, and you can create an account. And if you've got Medicare, I recommend creating a Medicare.gov account. There's a lot of cool stuff you can do in there. I'm going to make a video about that in the future, but for right now, we're going to continue without logging in. It's going to be for the current calendar year, because this is asking 2021. I want to find just a Part D drug plan. Enter your zip code. So I'm going to enter in this zip code here. It's going to ask me, is that where you want to be? Yep. Do you get help from any of these programs? For Part D plans, if you don't know the answer to them, you don't. Most people, they don't get any extra help from Social Security or Medicare savings programs. This is for programs for people with very low income. So I'm going to hit next. Do you want to see your drug cost? If you hit yes, it'll ask you your pharmacy information, put it all in. It'll ask you to put in your drugs. You can do all that if you want. For the sake of today, I'm not going to take all the time, but it will show you in that zip code all of the plans. So for here, there are 29 different Part D plans available in this particular zip code, in this particular county and state. And it'll go through and break down everything like that. So if you want to go through and search through all of those yourself, you can. But what if I told you whether you apply for a Medicare Part D plan online on your own, did all the research on your own, got it through the mail, that you got the same benefits, the same premium, the same drug list as if you got the plan from a professional insurance agency? One of the services that we provide, and I know a lot of other very good agencies across the country provide, is we want to keep up to date with your drug lists. So if you will communicate with your agent, I know we do contact all the time, keep them updated when you have a drug change, then what we do, and a lot of other good agencies will do, is we'll rerun your drugs every year in the fall when plan benefits change. And that way you'll know that you're not overpaying for your Medicare supplement part and your Part D plans. Okay, this is the one that gets a lot of people. What is the difference between Medicare supplement and Medicare Advantage? And I'm going to actually challenge you. You're asking the wrong question. The question is, what's the difference between original Medicare and Medicare Advantage? And some of you are going, Daryl, what? What are you talking about? Let's go back to the slides, and we put a lot of work into this today here. So when you have original Medicare, and all of this comes out of the Red, White, and Blue Medicare booklet, you start with Part A, which is your hospital inpatient, no premium for most people, but there is a deductible. Then you add your Part B, which is your medical, so your doctors. There's a separate Part D premium, separate deductible. And then you can choose to add Part D drugs, so that's another card with another premium, $10 to $30 a month. And then the Medicare supplement coverage, what this is this is at the bottom. It's designed to cover the unlimited 20% not paid by original Medicare, plus those deductibles, that separate deductible under Part A, that separate once a year deductible under Part B. So in addition to paying your Part A, in addition to paying your Part B premium and your Part D drug plan, you're getting a separate card with a separate monthly premium, anywhere from $100 to $200 per month or more possibly, based on how old you are and where you live. Now this works great because you do have 3 cards, 3 separate monthly premiums. And it's important to keep in mind that original Medicare always pays first. What's left over goes to your supplement. What people like is there's no networks, and if that provider accepts Medicare, then the supplement has to pay by law. So you end up with very little out-of-pocket medical costs, and it's very much a prepaid convenience. Your monthly premium covers most all of your leftover medical costs. So if you have Medicare and a supplement with your Part D plan, if you have a major illness, a major accident injury, you end up in the hospital for 6 months, and the bill is whatever the bill is, just an astronomical number. If you choose Medicare and a Medicare supplement, Medicare is going to pay 80% of that bill. The remainder of the 20% plus maybe some deductibles here and there is going to get picked up by your Medicare supplement. So the cost of your premium is virtually your out of pocket for your medical bills. And a lot of people like that. It works great. We offer a lot of different plans, different companies in that. But you do pay, it is a prepaid monthly convenience. Additionally, there is no coverage under Medicare for routine vision, dental, or hearing. Okay? So, Medicare supplements, no networks, works great. I can go anywhere, and I know up front what my premium costs are going to be and what my out of pocket are, because other than my premium, I really don't have much out of pocket unless it's dental, vision, or hearing. Okay? So now we want to take a look at Medicare Advantage. Now this is totally different. For Star Wars or Star Trek fans, I like to call Medicare Advantage and Medicare supplements matter and antimatter. They do not mix. Okay? So you start with your Medicare A and B, and it's Medicare Advantage is simply another way to get your Medicare coverage through private companies. You still have Medicare if you join a Medicare Advantage plan, but you're going to get a brand new card from your Medicare Advantage company, and that's the card you show to your doctors and hospitals. Most Advantage plans include prescription coverage under Part D built in, and you must always, always, always continue to pay your Part B premium in order to be enrolled in a Medicare Advantage. There are some additional things with this. This confuses people, but Medicare agency, CMS, they pay a fixed amount of money for your coverage every month to the companies offering Medicare Advantage plans. And these companies must follow the rules set by Medicare. And most Advantage plans require using plan doctors and hospitals, a network, either an HMO or PPO network. So if you're familiar and comfortable with today's employer group insurance, where you have a copay or something like that, Medicare Advantage will look very, very similar to you. And you are always, always, always covered for emergency or urgent care. This throws people, because your networks in a Medicare Advantage plan are generally tied to where you live. And if you take a trip, like if for people here that live in Kansas City, or maybe you live in Des Moines or you live in Seattle, if you take a trip and leave home, you leave your network behind. Well, with all Medicare Advantage plans by Medicare rule, you are always covered for emergency or urgent care when traveling. What does that mean? Emergency care simply means I'm having a life-threatening situation, serious illness, injury, something like that. I can go to any doctor who bills Medicare. In their contract, they agreed to bill a Medicare Advantage plan out of network when it's emergency or urgent care, or they don't get to bill for Medicare services for all the rest of their people. When Medicare Advantage plans have to follow Medicare rules, they have to pay the bill the same way. So don't worry about that aspect of it. So let's take a little bit of a summary on how this goes into. First of all, it is a pay-as-you-go plan. You're going to pay co-payments, but there's a limit on your out-of-pocket. Many have no deductible to satisfy. You will have a copay or coinsurance when you receive care, and by law, the total of your copays can be no more than $7,550 for the year, but can be lower. Now that's compared to Medicare, original Medicare, which is 80/20, but no cap. So if you had Medicare without a supplement and you had 100,000 of bills, your 20% could be 20,000. So that's where one area where Medicare Advantage might be a good alternative. Plus, many people like the fact that they can receive additional benefits like routine vision, dental, hearing, sometimes gym memberships, and other added benefits not found in original Medicare. So this is what your Medicare Advantage looks like. A and B is all combined into one plan with no separate deductibles. Usually your Part D is included with no additional premium, and you get one card to manage. You will have to use networks of providers, so you have to be comfortable with that. And you have to be comfortable paying a little bit as you go. It's a pay-as-you-go plan in exchange for paying very little or no additional premiums. The doctors will only bill the Advantage plan, and then they're going to bill you for the copay. but you have a limit on your yearly out of pocket, and you may get extra things like routine vision, dental, hearing, and some other benefits not found in original Medicare. And if it's not found in original Medicare, you don't end up finding it in your Medicare supplement plan. So that's one option there. Okay. Why is Medicare so complicated? Great question. I can only give you my opinion, and that's all this is, folks. My opinion based on almost 30 years in the insurance business and 20 of the 20 years working directly with Medicare and Medicare supplement type plans. Medicare is an extremely popular program, and it works really well. I do not mean to sound speaking ill of the Medicare program. But when some people get confused by the complexities, part of this is keeping in mind that we live in a political world. And Medicare, just like Social Security, like a lot of other government programs, comes about by the laws that our elected officials in Congress and the Senate can get passed at that time. Okay? And we see mood swings in Congress between one party and the other and political jockeying and all this other types of things. So even though Medicare is very popular, they still sometimes can have different circumstances based upon that decade. So for example, Medicare A and B started in 1965. That's what they could get the law passed. That's what Lyndon Johnson as a president was able to get passed through his Congress and sign. And it's not much changed out of the A and B format. The deductibles increase every year, but it works. It works. And then there was some changes in the 80s with Social Security and the trust fund and trying to make Medicare go out. And that decoupled Medicare and Social Security. So now you have this convoluted thing about signing up and when not to sign up based upon are you drawing Social Security or not. And then in 2003, Medicare Part D got passed into law. It took effect January 1, 2006, and they changed some things there. So they have law, stacked on law, stacked on law, stacked on law. In some ways, I sometimes refer to Medicare as the never-ending onion. You're always peeling the layers back, and just when you think you've got it all peeled back, you find a few more layers. That's kind of where that comes into play. Again, you can do it all on your own or contact a professional agent or agency. You can go through NAHU. You can give us a call. We can help you. You want a local agent in your area, we'll find you. I've been thrilled. The number of people have called, and we found them a local agent in their area, especially your folks out in California, San Francisco. Bless your heart. Okay. Why do I get so many phone calls and people showing up at my door? I love this question. Unfortunately, it is a reality of the wild, wild west. Number one, if you were Medicare, because it's so popular and people are turning 65, you can delay buying a car. You can hang on to that old one for a few years. You can delay going to a doctor's bill sometimes. You can delay buying a house. You can delay, now I don't want to go to the grocery store. But you can't delay your 65th birthday. And so there's a lot of business wrapped up around Medicare and people turning 65. And so if you were to go to my good friend Google here and type in a turning 65 list with phone numbers, you will see after row. So Medicare supplement insurance companies, agents, the phone rooms, all this type of stuff. And yes, folks, we here at AMS do buy turning 65 leads so that we mail people to here in the local area. It's the only compliant way that we can reach you to let you know we're offering our services other than the YouTube videos and some other things. Important to keep in mind that Medicare and CMS, the federal agency that manages the program, years ago passed a regulation that says agents are not supposed to call you without your permission first. Unfortunately, it's just not that enforced. Agents, if they're showing up at your door and I do get this from time to time, take their business card, call 1-800-Medicare, turn them in. They're not supposed to do that. It's not compliant. It doesn't get enforced, and I realize it can be a source of frustration for a lot of people. But in the same token, I want to talk about one other thing. I had a member in here the other day, and sweet, sweet gal, turning 80 of all things, and she was just activating Medicare Part B because she's had employer group coverage for the last 15 years. And she was asking me, why does Medicare keep calling me? Folks, government agencies, Social Security, Medicare, the IRS, they are not going to call you out of the blue. They will call you if you've asked them for a call back. But if I go to my good friend Google here, why do I keep getting calls from Medicare? The top thing that pops up is Medicare will never call you to your home uninvited. Social Security Administration representatives may call you only if they need more information to process an application for Medicare that you've submitted. Again, this is rare. So here's the answer to this question. If you're getting phone calls and the caller says, "Hi, I'm so-and-so from Medicare or Social Security trying to get you signed up for your Medicare program," unless you've called somebody, sent in an application recently, and specifically asked for a callback, they're not representatives of the U.S. government. Please don't fall for this stuff. So anyway, I'll get off my soapbox here a little bit. Well, that's kind of what we've run through today. I didn't get any questions here, so I was kind of hoping you might, but you can watch our video. If you leave us a question in the comment section, we'll be sure to answer your questions later on. As always, leave us a comment if you'd like us to do a particular video on a particular subject. Love to be able to take some time and break that down for you. We will be back again next Tuesday. We're going to do this every Tuesday at 4 o'clock Central Time. Next week, we're going to do a live tutorial on how to sign up for Medicare A and B when you've delayed Medicare due to work insurance. So hope to see you on that. As always, folks, if you haven't, be sure to click the like and subscribe button. You'll get notifications when we do new videos. For those of you that are watching on our Facebook channel, continue to like us, maybe share us with your friends. As always, we thank you. If you got questions, give us a call or text. But that's it. I wasn't expecting to take this long, but I get a long-winded sometimes. Thank you, folks. Have a great day.